Welcome to another episode of Chronic Briefs News. Yes, can you believe it? It's been a whole month already since the last installment of news. Now, in case this is your first episode, though, just a quick recap. We bring you news about chronic illness with our trademark flair, mainly because, well, we don't really get much play on other news outlets. So, without further ado, here is CBNN, the Chronic Briefs News Network. It seems that a team of Dutch and U.S. researchers have developed a new algorithm that can diagnose rheumatoid arthritis. Yes, it's true. Because humans are already so good at diagnosing and treating chronic conditions, they decided they could program a computer to do it. Fantastic, futuristic, terrifying. Apparently, this computer algorithm showed that around 35% of patients were misdiagnosed by their rheumatologist in early first appointments. Of course, rheumatologists responded by saying, well, we'll have to try it and see. So, same as always. The algorithm apparently uses a patient's genome as well as their clinical history to determine if the patient has gout, lupus, RA, or psoriatic arthritis, and if they have more than one at a time, the computer then explodes. Seriously, right? When in the long history of our chronic illnesses have we ever suffered from just one thing at once? Chronic illness is the free Las Vegas buffet of diseases, okay? Nobody wants to end up there, but when they do, they have one of everything, okay? Put that in your algorithm and compute it. Now, look, it's true. Getting a more accurate diagnosis is helpful, but since most RA and other chronic illness medications are done on a trial and error basis anyway, this story fits squarely in the cart before the horse category. This next story has a lot of potential for R-rated comedy, but we're going to do our best to keep it clean. Researchers at The Ohio State University claim that breast cancer survivors in romantic relationships who feel happy and satisfied with their partners may be at a lower risk for a host of health problems. Now, I know exactly what you're thinking, and that is, of course, well, anyone who's in a satisfying relationship is, of course, going to be happier. Right? Why? What did you think I was going to say? Mine's out of the gutter, people. This is a family show. Ish. Keep it clean. Look, the women who were satisfied in their relationships and also had a lower psychological stress level, it was associated with lower markers for inflammation in the blood. Yeah, apparently it's true. As if guys needed another reason to fight about not taking out the garbage. Now, when your partner says, "You're killing me," they literally mean, "No, you're literally killing me." Wow. What a special burden to bear. As if we didn't have enough pressure to worry about satisfying our partners in bed. Now it's a matter of life and death, as proven by science. Thanks, science. Once again, you've muddied the waters by making sensational claims about things no one ever asked you to study. Although, it's not all bad. I mean, God forbid anyone ever gets breast cancer. God forbid. But if you happen to get it, well, it's sure going to be fun trying to cure it. Remember, sex is like pizza. Even when it's bad, it's good. And comes with pepperoni. Okay, next. ALS, or Lou Gehrig's disease, is awful and one of the most devastating chronic illnesses anyone can be diagnosed with. A study by a Harvard Medical School researcher on a squid has shown some promise for a therapeutic treatment for ALS. Now, I won't bore you with the details. It gets pretty technical, but the gist of it is that a certain neurotransmitter in squids is similar to humans and can be replicated by electrical and chemical stimulation. Who knew, right? I guess squids are not just good for fried calamari, although wouldn't it be wonderful if you could mitigate ALS just by eating a bunch of calamari? That would be like curing my RA just by eating a bunch of fried chicken cutlets, which I can assure you does absolutely nothing for RA, other than make you want to eat more chicken cutlets, which again does nothing for RA. No matter what, though, for a crippling disease like ALS, which has very few treatments as it is wonderful news to hear that there's even a new approach on the horizon, even if that thing is squishy and smelly and tentacles and goes good with marinara sauce. A review of 56 clinical trials found that psychological and behavioral therapies may be effective non-drug treatments for reducing inflammation in the body. The results, published in JAMA Psychiatry, found that cognitive behavior therapy, or CBT, was superior to other methods to boost the immune system. Now, for those who don't know, Cognitive behavior therapy, or CBT, is just a fancy way to say talking to a professional trying to avoid negative thinking. Positivity. Yes, think positive. Don't be all doom and gloom. You're being dramatic. Just ignore it. Now, where have I heard something like that before? Oh, I remember. Everyone who ever gave advice to a chronically ill person, ever. Really? Really? Did we really need a published paper to put the stamp of approval on that old wives' tale of gibberish that just thinking happy thoughts and wishing on a star while singing in vibrato like an old-timey Disney princess, "Someday my prince will come," will make it all better? Like we don't have enough of a problem fighting off the legion of stereotypes that comes with arthritis and chronic illness. I mean, everyone and their brother has a cure, be it essential oils, diet supplements, copper bracelets, magnets, crystals, herbs, lotions, CBD, straight up weed, massage, acupuncture, not cracking knuckles, and of course, just keeping a positive outlook on life. We've heard it all, and the last thing we needed was an actual medical study to back it up. Now look, I am the first person to admit that therapy and counseling are extremely useful, and I have availed myself of them many times. But this study is claiming that those who suffer from chronic inflammation should use counseling as an alternative before medication. Now, I've seen some of the most well-regarded psychiatrists in New York, and no matter how good I felt after talking with them, I can guarantee you that none of their words made the swelling in my knees go down, or my wrists, or my elbows, or my collarbones. You get what I'm saying? Sure. A positive outlook and reducing stress always will help any illness, but it ain't pain meds, okay? I'll tell you that. And nobody, not even the Dalai Lama himself, can take away my hip replacement by talking. Sorry, Lama. Finally, we can end the new broadcast today the same way we ended the last one, funnily enough. It seems that Eli Lilly and Company, Lilly, is testing a new treatment for COVID-19 based on, you guessed it, another rheumatoid arthritis drug. This time, the drug they are testing is baricitinib, which is marketed under the name Olumiant. Olumiant is a Janus kinase inhibitor, or JAK inhibitor, which is yet another part of the immune system, and not a guy who sold his family's cow for magic beans. Jack and the Beanstalk? Get it? You know, folks, jokes just don't have the same impact if I have to explain them, so pay attention! Anywho, the new study aims to see if Olumiant could be used as a first-step treatment for a coronavirus to help save lives when the hyperimmune response, or what is also called the cytokine storm, hits a COVID-19 patient. This is what mainly kills people who have the virus, this super overwhelming inflammatory response. Just like last time when we told you about gold and gold salts being tested to fight COVID, this works in the same way. Since it's a rheumatoid arthritis drug meant to fight inflammation in patients with RA, the thinking is that it will do the same for those fighting the hyperinflammation of COVID. The study also aims to figure out if the drug might be an antiviral. I mean, call me crazy, but shouldn't you know if a drug is an antiviral or not before you bring it to market? That's like releasing a new type of hand cream that makes your hand feel like it's in its 20s again. And believe me, this hand in my 20s, woohoo, it had a ball, yeah. Anyway, yeah, it's like that. Releasing a hand cream that makes your right hand amazing, but it makes the left hand shrivel up and fall off. Why? Because no one thought to test it on a left hand. Yeah, it's as crazy as that. How do you not know if your drug has antiviral properties or not after it's approved by the FDA? Well, good luck, you 400 adults around the world who are slated to test it. I hope you're right-handed. Okay, folks, that'll do it for the Chronic Briefs News Network and the Chronic Illness News for June 2020. We'll be back next month, as usual, with more chronic illness news for those chronically inquiring minds who want to know. As always, the links to the articles will be in the video description, so you can read all the jargon yourself if you like. Most of it's pretty boring, though. In the meantime, as always, as you know, as you love, be kind, rewind, keep on keeping on, and we'll talk soon. Hi, Prince Eric. You don't look like your picture on Pick-a-Prince. Swipe left.